Hi, everyone. Welcome back to another episode of Ascend TV. I'm your host, Dr. Leslie Cadet. I am boarded in occupational and environmental medicine. And through Ascend, we help self-insured employers lower their workers' compensation costs. And I get asked a lot, how do we do that? And a lot of it is by reviewing the claim and looking for ways that the claim can be closed more expeditiously. A lot of times the patient is better, or there's nothing else that can be done to help the patient, but the claim is allowed to stay open forever, in a sense, many months beyond what is medically necessary. So I thought it would be helpful to go through some case examples to give you insight into how the way physicians are managing claims impacts your workers' comp costs. So in this example, we have a 50-year-old female. She's a housekeeper and she comes in with low back pain. And the mechanism of injury is that she was pulling a linen bag and dumping it into a barrel when she felt a strain sensation in her lower back. She then went on to bend over and pick up a trash bag, again of unknown weight, and felt a strain and a pull of her low back again. So when the primary treating provider first started taking care of her, he did what many of us would do, which is conservative care. She continued to complain of pain, leading him to get an MRI of her lumbar spine, which showed multi-level mild to moderate facet arthropathy. Now, in his follow-up notes for this patient, he documented that she had no pain, that acupuncture was actually helping her, and despite that, continued to insist on a lifting restriction of no more than 25 pounds. Now, why is it problematic to continue work restrictions in a person who says that their pain is over, they don't have it anymore? It's because you are running up the cost of the claim. So in a low back strain injury of this sort, we would surmise that her back pain should be over, resolved within 4 weeks, and that the self-insured employer would pay about $5,000 for the claim. Well, when you insist on keeping work restrictions in place and keeping the claim open and continuing to send her to PT or continuing to see her in clinic when she has no pain, and you go well beyond that, as in this case, this went on for 6 months, and the claim costs jumped up to $12,000, which is more than double of what the anticipated cost was when the claim was first open. So what can we do in this type of situation? Well, if the patient has come to you and they say they feel better, you can declare them at MMI. What if they say, I don't feel better? I still have this nagging 2 out of 10, 3 out of 10 pain. Well, we need to explain to the patient, well, you have arthritis in your spine. And some people have arthritis in their spine and they have no pain. And other people have arthritis in their spine and they do have pain. It just so happened you picked up some laundry, you strained the muscles and ligaments of your back. It has been 6 months. That strain has resolved. So we are at MMI. We're at maximum medical improvement. We don't anticipate that you're going to get any better, largely because you have pre-existing arthritis in your back. What a lot of us do is we want to inherit the arthritis. We want to adopt it into our family and hold on to this claim forever, which is actually not appropriate. If you've treated the underlying strain and the patient is still saying that they have some mild pain, or in this case, I have no pain, it's okay to close the claim and discharge them back to their primary care doctor for them to continue to treat any residual pain resulting from their arthritis, because the industrial component of their strain has been treated. Now, if you had 10 cases like this in a month, and we all see low back pain, bread and butter Ahmed, bread and butter orthopedics, if you see 10 cases like that in a month, and each case is costing the employer $12,000, that's $120,000 in a month, just on 10 cases. And if you replicate that every month, you end up looking at $1.4 million. And again, by setting expectations with the worker from the outset that, hey, you strained your back. This is simple strain. This should be over in a couple of weeks. And then recognizing, hey, there's an underlying condition that is causing their continued pain. I've treated the primary industrial injury. It's time to go back to the PCP. You can save your claim costs by half of this. It should not get to 1.4 million. Okay. So, how much is it worth if you're a self-insured employer and you have a cadre of providers who are taking care of your employees? How much is it worth for them to get additional training on these little nuances? I'd say it's worth $1.4 million easily, right? How much is it worth just to have tighter case oversight? Everybody is super busy, and in that busyness, no one's really paying attention to what's going on with the claim. And before you know it, your organization has spent $1.4 million when it should never have gotten to that amount, simply if somebody had some oversight and was tracking, oh, look, it's taking way too long for this simple low back strain to get better. What's going on, right? You can find out a lot earlier on, oh, actually, the patient's better. Provider's just not closing the case for whatever reason. So if this is something that your organization is struggling with, I encourage you to reach out. I have some information in the show notes that may be of interest to you. And until next time, bye.